Hello everybody, my name is Adesua Akano and I'm going to be telling us about California Proposition 23. Proposition 23 is a labor-backed initiative. It's also a version of a similar measure that was turned down last year by voters. California Proposition 23, the dialysis clinic requirement initiative, was on the ballot in California as an initiated state statute on November 3rd, 2020. Prop 23 was defeated. Kidney dialysis is a life-saving process in which blood is removed from a person's body, cleansed of toxins, and then returned to the patient. It must be done at least 3 times a week for several hours a section, and the patient must continue treatment for the rest of their life or until they can obtain a kidney transplant. The initiative does 4 major things. First, it requires a physician or a nurse practitioner to be in the clinic all the time patient is being treated, which is not currently required. Dialysis is a dangerous procedure, and if something goes wrong, a doctor or a highly trained nurse should be close by. Secondly, dialysis patients are prone to infection from their treatment, and this can lead to more serious illness or death. This initiative requires clinics to report accurate data on infections to the state and federal government, so problems can be identified, solved to protect patients. Thirdly, like every other life-saving healthcare facility, the initiative says dialysis corporations cannot close clinic or reduce their services unless approved by the state. This is also designed to protect the patient, particularly in rural communities, to make sure they have access to dialysis treatment and to stop the dialysis corporation from using closure to pad their bottom line. Fourthly, it prohibits clinics from discriminating against patients because of the type of insurance they have, and it protects patients in every clinic, no matter where they are located, whether in a wealthy neighborhood, poor, rural, black or brown community. Or clinic will be required to have a patient or nurse practitioner on site. All clinic will be required to report their infectious rate to the state federal government, and all dialysis corporations will be prohibited from discriminating against patients because of the type of insurance they have. The proposal is expected to increase government expenditures in the low tens of millions annually. Increased regulation would increase dialysis clinic costs, some of which would be passed on states and local government through higher medical reimbursement rates and increased medical insurance costs for public sector employees and retirees. Prop 23 was always more a product of a conflict between organized labor and 2 of the state's largest kidney dialysis clinic operators. The initiative was predominantly backed by Service Employee International Union United Healthcare Worker West, a union of nearly 100,000 healthcare workers in California, while it was opposed by the state's 2 major clinic operators, Davita and Fresenius Medical Care. Proponents' argument for the union argued that quality of care at dialysis center is declining even as costs to patients are rising. They argue that these centers are making massive profit, and many dialysis clinics in California have been cited for failure to maintain proper standard of care. Failure to maintain standard of care can lead to patient harm, hospitalization, and even death. Proponents point to rapid growth in 911 emergency calls from dialysis clinic in recent years, driven by a lack of adequate staffing on site to handle medical emergencies. Patients should have access to a physician on site whenever dialysis treatment is being given. Then proponent arguments against Proposition 23 would force community dialysis clinics to cut services and close, putting lives at risk. Also, it would force dialysis clinics to have physician administrator on site at all times, even though they would not care for patients. Each dialysis patient is already under the care of their personal kidney physician, and dialysis treatments are administered by trained and experienced dialysis nurses and technicians. According to Makita Oskova, states that the bureaucratic mandate will increase clinic costs by hundreds of millions annually, putting half of all clinics at risk. Prop 23 dangerously reduces access to care, putting vulnerable dialysis patients at risk. The president of California Medical Association, Dr. Peter, stated that Prop 23 would make physician shortage worse and lead to more emergency room overcrowding. Prop 23 will take the thousands of doctors away from hospitals and clinics where they are not needed and place them in bureaucratic jobs at the dialysis clinic where they aren't. This is not the time to make a physician shortage worse. Even emergency room doctors strongly oppose that Prop 23 will force dialysis clinic to close, sending tens of thousands of vulnerable patients to emergency room, creating longer ERO wait and reducing capacity to deal with serious emergencies. Prop 23 would increase healthcare costs by hundreds of millions. According to Dr. Jeffrey, the president of Renal Physician Association, every dialysis patient is under the care of a physician kidney specialist, and dialysis treatments are administered by specially trained nurses and technicians. It makes no sense to require a physician administrator on full time. Finally, the danger of dialysis can be minimized by reducing the number of patients who require dialysis. The government could stop, prohibit cash compensation for live kidney donors, which would allow more transplant and less need for dialysis services. Currently, there are about 19,000 California candidates on kidney organ transplant waiting list. Kidney donors must take time off, suffer discomfort, and accept increased health risks that come with having only one kidney. If donors were properly compensated for their considerable sacrifice, more people would likely be willing to donate. Thank you.